We start. You please ensure your microphones are placed on mute for today until your name is called. So we're going to go with Vicky Harris.
Here.
Andrew Waugh.
Yep.
Maria Isabel Noel.
Here.
Sarah Seeley.
Here.
Laura Lyle.
Here.
Alan Cochran.
I'm here, Bruce.
Philip. jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today in the following order. The Honorable Dorothy Shephard, Minister of Health. Dr. Jennifer Russell, the province's Chief Medical Officer of Health. The Honorable Dominic Cardy, Minister of Education and Early Childhood Development. And the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont l'Honorable Dorothy Shephard, Minister.
The Honorable Dorothy Shephard, Minister.
La médecin hygiéniste en chef, le Dr. Jennifer Russell. L'Honorable Dominic Cardy, Ministre de l'Éducation et du Développement de la Petite Enfance. Et l'Honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Avant de céder la parole au ministre Shephard, voulez-vous assurer de désactiver le son de vos micros? Before I turn things over to Minister Shephard, I would like to ask everyone to ensure their microphones are placed on mute. Minister Shephard.
Good morning, bonjour. Right now, we are on the precipice of the most serious situation our province has seen since the COVID-19 pandemic began. With the accelerated spread of the Omicron variant, we are seeing new cases in numbers that would have been unimaginable just a few short weeks ago. We are already reaching and surpassing daily case count records now, and we've seen in other jurisdictions the Omicron variant of the COVID-19 virus cannot be stopped. However, we can and must take action to slow the spread. As we have done throughout this pandemic, we must all adjust our thinking and our strategies to address this new reality. Every region of Canada is now reporting record levels of COVID-19 infections. In Ontario and Quebec, the numbers have exceeded 10,000 new cases a day. New Brunswick is experiencing its own dramatic rise in infections. At the current rate of growth, we could see as many as 1,000 new cases every day within a week. While our hospitalization numbers remain relatively low, that is likely to change in the days ahead. Omicron, particularly among vaccinated people, and especially those with a booster, does not appear to have the same severity as the Delta variant. The hospitalization rate for Omicron is less than 1 in 100 cases, compared to almost 6 with Delta. That doesn't sound like much of a problem until you factor in how quickly Omicron spreads. The sheer volume of cases is the concern. If we hit a rate of 1,000 cases a day, we could see more than 160 COVID-19 patients in hospitals across New Brunswick by mid-January. That would very quickly overwhelm our healthcare providers. It would jeopardize the ability to deliver critical health services. This means we must do things differently. Donc, nous devons faire les choses différemment.
This means we must do things differently.
We know that hospitals will feel the strain, and they will be impacted by the rise in cases. Hospitals across the province in both regional health authorities are moving to urgent and emergency services only. This means New Brunswickers can expect to have their non-urgent and elective surgeries, procedures, and lab services canceled. I understand the impact that this will have on many patients who are waiting for surgeries or diagnostic tests, and I share my sympathies with the patients and families who will be affected by this necessary change. Unfortunately, the Omicron variant is already worsening existing staffing shortages in the health system. We expect this situation will become even more challenging as we live through this latest wave of COVID-19. I want to speak about what you can do to help slow the spread of the COVID-19 virus. The most important thing is to realize that COVID-19 is all around us. Ce qui est le plus important, c'est de
What is the most
réaliser
important
que la
is to
COVID-19
realize that
est
COVID-19
partout autour
is
de nous.
all around us.
It is present in every community, in every region in our province. It is vital that everyone remain vigilant and watch for the emergence of COVID-19 symptoms in themselves and their families. When symptoms emerge, use a rapid test to confirm the presence of the virus. Although our situation is changing, the fundamentals of infection control remain the same. You are not required to learn new skills to slow the spread of this very contagious strain. You simply must continue to do what you've been doing since the spring of 2020. Wear a well-fitted mask when you are in a public place. Maintain 2 meters of physical distance from others. Avoid large crowds in places where you will be in close contact with others. Keep your circle of contacts small, a steady 10 or less, and get vaccinated. If you have had 2 boosters, get a booster shot as soon as you are eligible. Si vous avez reçu 2 doses, obtenez
If you've
une
had
dose
2 doses,
de rappel
get a booster
dès
shot
que vous y
as soon
avez droit.
as possible.
Nearly 20% of New Brunswickers have already received their 3rd dose, including 44% of New Brunswickers over the age of 65. The booster shot will provide additional protection as the Omicron variant spreads. The coming weeks will be very challenging to our province. The situation is serious, but we can move beyond it by continuing to follow the guidance provided by public health. More than ever, we need to look after ourselves, our families, and our communities. We need to be aware of the risks that surround us and take actions that will minimize those risks. We really are all in this together. While we are dealing with stress and uncertainty right now, my heart goes out to our healthcare workers. Throughout this pandemic, they have consistently stepped up and done so much to take care of New Brunswickers. Now they are facing another challenge. I want to remind everyone to be kind and patient while navigating the health system in the weeks ahead. Please keep in mind that everyone is tired, but everyone is doing their very best to continue to provide the essential services New Brunswickers need. Frontline healthcare workers and paramedics, our doctors, our nurses, every healthcare provider have done so much already. We will lose many of them for a period of time, meaning others will be overtaxed. We know this will happen, and we all owe much gratitude to them, and we need to support them. If we remain focused and vigilant, kind and compassionate to ourselves and to others, we can get through this together. Thank you. Merci.
Good morning, everyone. Bonjour. Le Nouveau-Brunswick est maintenant frappé de toute force par la dernière
Brunswick is now
vague de
being hit
pandémie
hard by the
de
latest wave of
COVID-19.
the
Les
COVID-19
prochaines
pandemic.
semaines sont susceptibles
The next
d'être
few
les
weeks
plus
are
difficiles que
likely
nous
to
aurons
be the
connues
most
au
difficult we had
Nouveau-Brunswick
experienced
depuis
in New
l'apparition
Brunswick
du virus
since the
dans la
virus
province.
first appeared in the province.
New Brunswick is now experiencing the full force of the latest wave of the COVID-19 pandemic. The weeks ahead are likely to be the most difficult we have experienced in New Brunswick since the virus first appeared in our province. In light of the way the virus has evolved and the way the Omicron variant is spreading so quickly, we need to evolve as well. Bien que le niveau 2 du plan pour l'hiver soit
As level
toujours
2
en
of the
place,
winter
à
plan
compter du
is
mardi 4
in
janvier
place,
en fin de
starting
journée,
March
Santé publique
4th,
adoptera une
Public
approche
Health
différente de
will
la
have
gestion
a
de la
different
COVID-19
approach for the
en raison
management
du
of
nombre élevé de
COVID-19
cas
because of
et
the
des
high number
ressources
of
limitées.
cases and limited resources.
L'objectif de cette stratégie
The
est
goal of our
d'atténuer les
strategy
répercussions
is to
sur le
mitigate the
système de
impact
soins de
on
santé
the
et
healthcare
les autres
system and other
infrastructures
critical
essentielles.
infrastructure.
While level 2 of the winter plan is still in place, beginning at the end of the day on Tuesday, January 4th, Public health will be taking a different approach to addressing how COVID-19 is managed due to the high number of cases and limited resources. Our goal with this strategy is to mitigate the impact on the healthcare system and other critical infrastructure. Starting at the end of the day on Tuesday, diagnostic PCR tests will only be used in specific situations. They will be reserved for areas at highest risk, including healthcare workers and people who live or work in long-term care facilities, homeless shelters, and correctional facilities. In addition, people who are symptomatic and over 50, those who need a test for travel, and those who are identified as a priority by public health will also have access to PCR testing. Everyone else, including people who are symptomatic but under the age of 50 and not in a vulnerable setting, will take point-of-care rapid tests instead. A positive rapid test will be treated as a positive result, and individuals will need to register their test online through a new form that will be available on the GNB COVID-19 website next week. They will also need to follow new isolation guidelines. Pour protéger notre infrastructure
To
essentielle,
protect our
dont les soins
essential
de santé,
infrastructure,
l'électricité, l'eau,
electricity
l'application
system,
de la loi,
water
les
system,
transports, la sécurité alimentaire
transportation,
et l'éducation, nous
education,
introduirons une
we will
période d'isolement
introduce
plus courte
an
pour les
isolation period
personnes
that is
qui ont
shorter for the
obtenu des
people
résultats
who have
positifs à
had
leur test.
a positive result
To
test
protect our
result.
critical infrastructure, including healthcare, power, water, law enforcement, transportation, food security, and education, we will be introducing a shorter isolation period for people who have tested positive. Les personnes vaccinées qui ont reçu
Vaccinated
un résultat
individuals who have
positif au
tested
test de
a
dépistage ainsi
positive
que les
test
contacts
as well
étroits
as vaccinated
asymptomatiques
asymptomatic
vaccinés
close
devront
household
s'isoler pendant
contacts
5
will need to
jours.
isolate for 5 days.
Les personnes non vaccinées qui ont reçu un
Unvaccinated
résultat
individuals
positif
who
au
have
test de
tested
dépistage
positive,
ainsi que les contacts étroits
as well as
asymptomatiques non
unvaccinated
vaccinés
asymptomatic
devront
close
s'isoler
household
pendant
contacts
10 jours.
will need to isolate for 10 days.
Vaccinated individuals who have tested positive, as well as vaccinated asymptomatic close household contacts, will need to isolate for 5 days. Unvaccinated individuals who have tested positive, as well as unvaccinated asymptomatic close household contacts, will need to isolate for 10 days. Close contacts outside of a household will be asked to mask continuously, avoid vulnerable settings and individuals, and limit their contacts as much as possible. Pendant les 5 jours suivants la
For
période
5 days
d'isolement,
following the
les
isolation
personnes
period,
doivent porter un masque en
individuals
tout
should
temps
wear a
et
mask at all
éviter les
times
milieux
and avoid
vulnérables et
vulnerable
les rassemblements.
environments and gatherings.
Upon release from isolation, people must wear a mask continuously and avoid vulnerable settings and gatherings for the next 5 days. If a close contact develops symptoms, they will be directed to conduct a rapid point-of-care test unless they meet the requirements for a PCR test. Just as is happening now, transmission of the virus may occur after the isolation period, but this will mitigate a large amount of spread as long as people follow the guidelines properly. With this rapid growth in cases, we do not have the resources to track down every single new case of COVID-19 and their direct contacts. Widespread contact tracing is no longer an effective strategy. We must focus our efforts on protecting those who are most vulnerable to this virus and settings where the virus can spread quickly and do great harm. People who test positive will be asked to notify their own contacts and household members. Nous nous attendons à ce que la
We are
transmission
expecting
communautaire
community
atteigne un niveau
transmission
sans précédent.
To be at an all-time high.
Cela signifie que la population devrait
This means
être
that the public will need to be
vigilante
vigilant
et surveiller l'apparition des
and monitor
symptômes.
for symptoms.
La recherche des contacts se poursuivra,
Contact tracing
mais
will
elle sera
continue,
surtout réservée aux
but will be
personnes en milieu
reserved mostly for
vulnérable.
people in
Le
vulnerable
but est de
settings.
prévenir la transmission
The
autant
goal
que
is to
possible
prevent
parmi les
transmission as
personnes
much
les
as
plus
possible among
susceptibles
those who are
d'être
most likely
hospitalisées
to
tout
be
en gérant
hospitalized
adéquatement
while
nos
properly
ressources.
managing the resources we have.
We are expecting community transmission to be at an all-time high. This means that the public will need to be vigilant and monitor for symptoms. Contact tracing will continue, but will be reserved mostly for people in vulnerable settings. The goal will be to prevent transmission as much as possible among those who are most likely to be hospitalized while properly managing the resources we have. Some of the elements of this strategy are a significant departure from what we have done so far. This new approach has been considered very carefully by public health. We've had discussions across the country with several colleagues that are going to be heading in the same direction in their jurisdictions. We feel strongly that these are the best actions we can take to create the least disruption of New Brunswickers' lives. Pendant le gros de la pandémie,
During the
notre
biggest part of the
objectif a été de
pandemic, our
contenir le
goal
virus.
was to contain the
Avec
virus.
la présence d'Omicron,
With the presence
ce
of
n'est plus
Omicron,
possible.
this is
Nous
not
devons
possible anymore.
maintenant mettre
We now
l'accent
need
sur
to put the
l'atténuation des
emphasis
répercussions
on
sur notre
mitigation of
système
the
de santé
impact on our
et nos
healthcare
résidents
system
vulnérables.
and our vulnerable residents.
For most of the pandemic, our goal has been to contain the virus. With the presence of Omicron, that is no longer possible. Now, we need to focus on reducing the impact on our health system and on our vulnerable residents. This is a new phase in the pandemic, but since March of 2020, we have all been in this together. That is still the case now. As we head into a new year, with this new strategy in place, we need to keep doing some of the things we have done all along, as mentioned by Minister Shephard. We need to wear a well-fitted mask. We need to get vaccinated and get a booster when eligible, and we need to limit our contacts as much as possible. Je tiens à mentionner que pour les personnes
I'd like to
admissibles à
mention
une
that
dose
for
de
people who
rappel,
are
nous
eligible for
disposons
a
d'une
booster shot,
quantité
we
suffisante
have
de
a
vaccins
sufficient
Moderna,
quantity of
même
Moderna
pour les personnes
vaccines,
qui ont reçu
even
le
for the
vaccin
people who have
Pfizer
received
BioNTech
the
pour la
Pfizer
première ou
BioNTech
deuxième dose.
vaccine for the
Ces
first and
vaccins
second
sont
doses.
tout à fait
These vaccines
interchangeables
can
et sont
be
tous deux
interchangeable
efficaces et
and are
sans
both
danger.
efficient and
For
without any
those who are
danger.
eligible for a booster dose, I do want to note that we have ample supply of Moderna on hand, including for those who have received the Pfizer BioNTech vaccine for their first or second dose. These vaccines are completely interchangeable, and both are safe and effective. The federal government has indicated that the national supply of Pfizer vaccine is limited until April 2022, and the NACI has recommended that Pfizer be made available for individuals 12 to 29 years of age, as there is evidence that the risk of myocarditis or pericarditis for this age group is lowered with Pfizer. To preserve our Pfizer supply for the future booster clinics for those aged 12 to 29, we will now be offering Moderna at all booster clinics for current eligible groups. New Brunswick is not alone in changing our approach. We are taking similar steps that other provinces have already implemented related to testing, isolation, and contact tracing. Please continue to do your part to stay safe and take care of one another. Thank you. Merci.
Good morning, everyone. Bienvenue. So a few weeks ago,
Welcome.
the province unveiled its winter plan for schools and early learning and childcare facilities as part of the broader plan to push back against COVID-19. We were aiming as much as possible to manage the risks of COVID-19 throughout the coming months and to align our approach in the schools and early childhood education with public health. Before getting into the details today, I just want to take a moment again to thank teachers, staff, educators for the work done over the course of the difficult months from September to December of last year with the new school year. And all of us are hoping to have a quiet rest of the holidays and hopefully a quieter year ahead. But as Minister Shephard, as Dr. Russell have said, we are going to be in for a difficult few weeks coming up. Je le répète régulièrement. Mais je veux vous assurer que nous travaillons toujours en étroite collaboration avec la santé publique pour évaluer nos plans, les mettre à jour et nous assurer qu'ils reflètent les renseignements les plus récents. In light of the recent spread of Omicron cases across the provinces and around the world, we have had, once again, to pivot our strategy as COVID-19 has adjusted and evolved. We were looking forward to welcoming students back to in-person learning in our province's K-12 schools on January 10th. Unfortunately, the situation has evolved and circumstances have changed. En raison de l'augmentation de nouveaux cas et du variant,
Because of the
les
increase
élèves
of new
resteront
cases
à la
of the
maison
variant,
pendant au moins
students
2
will
semaines,
stay at home for
jusqu'au
at least 2
vendredi
weeks
le 21
until
janvier.
Friday,
Cette décision
January
sera
21st.
réévaluée la
This
semaine du
decision will be
17
reassessed
janvier.
on the week of the 17th.
L'apprentissage à domicile commencera le
Learning at
11
home will
janvier
start
pour
on
donner aux enseignants le temps de se
January
préparer
11th
à
to
la
give
transition.
teachers the time to prepare for this transition.
In light of the current situation with the Omicron variant, students will learn from home beginning on January 11th until at least Friday, the 21st of January. This decision will be reevaluated on the week of the 17th of January. This situation is far from ideal. In-person learning is more effective for most students, and students rely on services and programs offered through schools to help support their mental health, to offer them food security, and to provide a myriad of other supports. Nous savons également qu'il pourrait y avoir des impacts sur les horaires d'évaluation et nous communiquerons à ce sujet au fur et à mesure de l'évolution de la situation.
Schedules and we'll provide
We
more
know
information
that there will be
regarding that
impacts
along the way.
on exams in the Anglophone sector, and you can expect to hear in the coming days from schools and teachers about how those issues will be handled. This is going to create an impact on our at-risk and vulnerable students. So we will be working with schools to look at what supports we may be able to provide. So affected students families will be provided with more information directly next week. For the time being, students who've received rapid test kits through their schools, and there were over 1 million distributed through the school system over the last number of weeks, those students, please hold off on using those kits unless you become symptomatic, until we have a confirmed return to school date. So we appreciate that everyone has those kits. Keep them warm, keep them safe at home. Please don't use those school kits until we have a confirmed back to school date for in-person learning. These decisions are intended to manage risk, to protect our communities and our hospital system. And they were not made lightly. Nous savons que, même avec cette transition vers l'apprentissage à domicile temporaire, il y aura encore des cas dans les écoles au cours des prochains mois.
Over the next few months.
As Minister Shephard has said, we are facing a rising tide of cases. Il y aura encore des cas dans les écoles. These decisions are intended to manage risk, to protect our communities and our hospital system. They were not made lightly. Nous savons que safe, so that we can get to the other side of this outbreak. That's going to require support and assistance from all New Brunswickers. It's going to also require the active engagement of the school system. So these decisions, as difficult as they are, as undeniably negative an impact as they have on our students, are being made because we have to protect our hospital system. And we will do our very best to manage that flow of water over the dam to keep it controlled and safe so that we can get to the other side of this outbreak. That's going to require support and assistance from all New Brunswickers. It's going to also require the active engagement of the school system. So these decisions, as difficult as they are, as undeniably negative an impact as they have on our students, are being made because we have to protect our hospital system. And we will do our very best in the department to work with teachers, with staff, with educators in early childhood development, to come up with ways to mitigate learning losses and any other negative impacts that will come from these decisions. Nous continuerons à ajouter des coûts.
We will continue to add protection layers everywhere where it's possible, as we have mentioned in our winter plans.
Sports and extracurricular activities, those restrictions will continue as well until we have a confirmed back-to-school date. Once again, we're looking to our early childhood education sector to be there for our province, the way they have been from the very first days of this pandemic, when schools closed, when everyone worked from home, and our educators braved a disease that at that point we did not know at all, so that they could offer services to the children of our essential workers. And we know that our early childhood education sector is up for the task, and I want to thank them again for their work. Many operators have expressed understandable concerns about the challenges that our plans have imposed and will impose. So I was very pleased last night to be able to share with operators across the province that we are offering early childhood education facilities, financial support packages to support healthy and safe learning and childcare. This will include a $200 per month per educator wage top-up, retroactive to December 1st of this year, which will continue to March 31st of next year, and a $50 per space per month amount, which will be provided to any centers operating under level 2 or 3 of the winter plan. That starts tomorrow, January 1st, and will continue to March 31st of next year. And both those plans will be evaluated at that point, and hopefully we'll be able to, at that point, be looking at the other side of this Omicron outbreak. Ils font également partie de notre groupe prioritaire.
They're also part of our priority group to receive booster shots, and I encourage everyone to participate.
Who've expressed a lot of confusion about when their children can attend childcare facilities. This time, we have to continue to protect our most vulnerable portions of the population. So, as per public health guidance, if one new or worsening symptom develops, a child or staff member is not permitted to attend a childcare facility until they have a negative point-of-care rapid test. If a child or staff member has a constant or recurring symptom, for instance, seasonal allergies, they may continue to attend the childcare facility and no COVID-19 rapid test is required. So for those who've been concerned about their children having runny noses and the impact that has on their ability to attend their early childhood education center and their ability to go to work while their child is being kept home, to reassure you on this, please look for new, changing, worsening symptoms. That's what we're looking for here. If your child always has a runny nose, that's not a problem. If it changes, if it gets worse, that is. We recognize that even that is a difficult imposition, but again, as you heard from Dr. Russell, as you heard from Minister Shephard, we require difficult decisions at a time which is difficult for a province. Nous avons besoin que les Néo-Brunswickois continuent de...
We need to make sure that New Brunswickers continue to focus on these efficient measures. So please continue to help us keep our most vulnerable people remain healthy while we are continuing to fight against COVID-19.
Peaceful rest of the winter break before home learning begins in the schools and the rest of our province continues with a battle against COVID-19 that I hope will be soon reaching its final phase. Thank you very much, merci, and it's now my pleasure to be able to introduce the Premier of New Brunswick. C'est mon plaisir d'introduire le Premier ministre du Nouveau-Brunswick.
And now I can introduce Mr. Premier, the Honorable Blaine Higgs.
Thank you, Minister. Bonjour, good morning. It's hard to find anyone in New Brunswick who is not affected personally by COVID-19. Maybe you are isolating because you have tested positive or you are a close contact. Un membre de votre famille
Member of your family,
A family member or close friends may have contracted COVID-19.
There are cases in businesses and schools and daycares. The fact is, we are all affected and we're all in this together. And that includes me. Like most of you, my own family has had multiple close contacts. Like so many of you, I have been rapid testing and monitoring for symptoms. Several days ago, I came down with a cold, what seemed to be cold symptoms in any way. Wednesday morning, I did the test and it came back positive. And I'll now be getting a PCR test. My family and I are now isolating and we're all doing well. I have a bit of a cough, I have a sore throat, some head congestion, and the symptoms are very much like having a cold. But having said all this, I'm thinking how fortunate that we are and how blessed we are in this province to have access to vaccines. You know, I've been able to continue working and attending meetings virtually. And when time permits, you know, it's an opportunity to maybe sit back for a moment because after all, this is supposed to be a break period. But it seems in New Brunswick, break periods aren't like they used to be. I know we each have had our own experiences, so I can only speak to mine, but I can tell you this. I am double vaccinated. Plus, I've had my booster. And because of that, I'm confident that my symptoms will remain mild. In addition, my family, my wife, Marcia, has been double and triple and boosted as well as my family members. Je sais que tout le monde a sa propre.
I know we each have our own experiences, so I can only speak to mine. But I can tell you this, I am double vaccinated, plus I've had my booster. And because of that, I am confident that my symptoms will remain mild.
This is why I hope that my symptoms will remain. This is manageable. We've had previously made very difficult decisions not to visit my in-laws during this Christmas period. We wanted to protect them, and now, given the circumstances, we know we did the right thing. I'm hopeful many of you made the same decisions and will continue to make the right decisions going forward as we enter New Year's Eve. And as we think about, it would be great to get together as a group. But if you can avoid doing that, you can have an impact, a direct impact on reducing the spread of this variant. We've all determined that none of us are immune to this, including obviously myself. But we do know vaccinations work. The statistics show it greatly reduces your chances of getting seriously ill or dying from COVID. Nous savons que cette dernière.
We know that this latest variant, Omicron, is much more contagious, but less aggressive in terms of symptoms. However, people with weakened immune systems, those with underlying health problems, and our elderly and frail must be protected.
The ultimate goal right now is to ensure that we do everything we can to minimize the impact on our health system. That is really what it comes down to. We want to be able to live as normal a life as possible while ensuring the healthcare services we all count on remain intact. Si vous faites un cri,
If you have a heart attack or a gallbladder attack or another health problem that requires immediate attention, we want the services you need to be available and a bed to be available.
we're doing everything in our power to ensure that we're not going to be in a position where our health professionals are choosing who lives and who dies when death is preventable. Any measure we are asking you to take is with that ultimate goal in mind. We know we can't stop this, but we must limit it as much as possible. And as cases are going up and will continue to grow to the point that it's going to be very difficult to report accurate case counts on a daily basis, especially now that people will be, for the most part, rapid testing. We will continue to provide as much information as possible on our dashboard. But hospitalizations and the number of people in intensive care are the triggers. These are the numbers that we are watching, and they're really the ones that matter most. The transmissibility.
The transmissibility of the Omicron variant means that the number of cases is expected to increase. This is inevitable. Our goal is to slow the spread so that hospitals are not overwhelmed with people who are vulnerable and more likely to have more severe symptoms.
After nearly 22 months of living with COVID-19, we're all tired of having to be resilient. Believe me, when I say I feel the same way as you do, I really do. We must dig deep to find our untapped reserves so that we're able to continue this fight.
We must dig deep to find our untapped reserves so that we are able to continue this fight.
Of those who are still vulnerable, we must continue to listen to public health as we learn more about the Omicron variant.
To ensure the well-being of those who are still vulnerable, we must continue to listen to public health officials as we learn new things about the Omicron variant.
We must continue to remain vigilant, even though we are so tired of this COVID. Monitor for symptoms, keep our contacts low, and follow public health measures. Government can advise you on best practices, but in the end, it's up to each one of us, because we all know what is the right thing to do. We all know someone who needs protecting if we don't feel we need to protect ourselves. Perhaps they're elderly and frail. Maybe they are fighting cancer and have a weakened immune system. Une personne que vous aimez est peut-être au
Someone you love may be at risk because of a chronic health condition like diabetes or asthma. That's why you need to ask yourself what you can do and also what you should avoid doing to protect your loved ones.
government crackdown or obeying rules. This is a call for help, for everyone to do their part, once again, to protect each other. And you know what the risk can be to yourself and to others. The coming days will not be easy ones, as you have heard. You know the cases are rising everywhere in the country, and we must protect our hospitals. We ask every medical professional, every doctor, to ensure that any activity in the hospital is urgent, any activity is a requirement, so that we can truly make sure we protect the situations that are life and death threatening. I know that New Brunswickers have the courage and determination that we need to get through this. And I know I've said it many times before over the past 2 years. And I am hopeful, you know, as we've heard positive reports about this particular variant, it can be a little different. It can be a little milder, particularly for those that are fully vaccinated. I'd like to think that I am a demonstration of that. And even though I can be contagious to others, at this point, I would say the vaccines are certainly working. And I encourage everyone who is eligible to get your vaccine, your booster, as soon as you possibly can. We have seen many incredible examples of neighbors supporting their neighbors throughout this pandemic. Vous avez livré des...
You delivered groceries, medicine, and Christmas meals to others. You have sent messages to people asking for what they need. Now, I ask you to think about and care for the people on the front lines of this pandemic and take care of them.
Thank our healthcare workers, who I know just want to be done with COVID. And I know are tired of showing up at the hospital, particularly when they're seeing patients come in on ventilators who have chosen not to be vaccinated. This is particularly troublesome, especially when we see such a rapid case count as we're seeing right now. And we can only hope that we do not see these large quantities show up in hospitals that will affect others, that it isn't about COVID, but it has a direct impact because we're not protecting each other as we could. To our nurses, doctors, and every healthcare professional, I want you to know our province needs you more than ever. We appreciate you and we stand with you. We will continue to support you wherever we can and to make improvements and changes in the system on a go-forward basis in any area possible. Nous allons combattre ce virus.
We will fight this virus together, and we will emerge stronger, more united, and more resilient than ever before.
May we find strength in one another and the resolve to do whatever it is in our power to keep one another healthy and safe. And I know it's hard to say have a happy new year, but let's just all believe it will indeed be a happy new year, because we will see this as our last wave. It will become the end of COVID, certainly as we have known it over the last 2 years. And we will get back to family life and quality life with our friends as we once knew it. Thank you very much. Merci.
I would like to thank all our podium speakers. Je tiens à remercier tous nos conférenciers. We will now proceed with questions from members of the media. Each reporter will have one question and the quickest second question. You have the right to pose your questions in the official language of your choice. Maintenant, on va procéder aux questions, période de questions avec les membres des médias. On va faire une question et une deuxième question rapide. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Please ensure your microphones are muted. Voulez-vous assurer de désactiver le son de vos micros? Vicky Hogarth, CHCO.
Thank you, Bruce. Dr. Russell, with regards to the reduction of isolation time for fully vaccinated individuals, can you speak to the evidence that informed that decision? what time period in contracting the Omicron variant is an otherwise healthy and fully vaccinated person most contagious? And do you think this will perhaps motivate more unvaccinated people to get vaccinated?
Hi, Vicki. So in terms of the data that we can look at, there is with the Omicron variant in particular, we know that the period of contagiousness is shorter. We know that the time that the virus is shed is shorter. Is it right at the 5-day cutoff? No, it's not exact. And just as the requirements for isolation prior to this change have not been exact in terms of, we look at a curve in terms of where we're going to get the most amount of benefit from the measures that we recommend. So, and it is true that people who have been vaccinated with their second dose as well as their booster dose have a lower chance of getting COVID-19 and a lower risk of transmitting. But the main benefit is really that of keeping people out of the hospital. So as we know, with the impending number of cases that we're going to see rising on a daily basis, as we've seen throughout the country, we do expect hospitalizations to go up. So at this point in time, vaccination is our best defense in terms of requiring, in terms of what we're offering right now. We're offering that to 50 plus right now, the booster doses, and we're offering first and second doses to children aged 5 to 11. And that will continue to be our focus, as well as increasing our capacity and human resources to be able to do that.
Thank you. A quick second question, Ms. Hogart.
Thank you, Bruce. We currently have 40 people in hospital with COVID-19, 11 on a ventilator. If we do see 150 people in hospital shortly, do we have enough ventilators, and how many are we projecting that we need? And I guess on that note, are we seeing people going to hospital with the Omicron variant just as much as they were with Delta?
We can only assume that Omicron variant could be in hospital because right now we know that it's the dominant variant that's happening, and having an accelerated 150 people in hospital could certainly be very detrimental. We do have enough ventilators. The problem is having enough human resources to man them. So that's going to always be the challenge. It has been the challenge since March 2020, and always what we prepared for.
Thank you. Andrew Waugh, Brunswick News.
Thanks, Bruce. So you four spent a lot of time in this press conference talking about how dire things are, and talking about how things are inevitably going to get worse. I know level 3 is based on hospitalizations, but a couple of you said they're going to increase too. And we know St. John Regional's got 95 people out. Why aren't we moving to level 3? What are we waiting for?
Andrew, the decisions have always been based on public acceptance, public buy-in, and so we know the goal we're trying to achieve. We know that New Brunswickers can help us with that, and we know that there is no perfect answer here. So our hospitals are going to level 3. They are going to be operating and preparing for what we know could happen. And so that's really the crux of our whole preparation here, is our hospital system and our healthcare professionals. I'll just update your numbers on the St. John area staff. We have 300 that are out in the St. John area. Province-wide, we have 468.
Mr. Waugh, quick second question.
Yeah, given that you've abandoned contact tracing, well, do-it-yourself contact tracing, and now it's do-it-yourself testing, does the province have any idea how much COVID is actually circulating in New Brunswick? I mean, I don't see from a logic and evidence position how that would be possible.
Hi, Andrew. So across the country, all jurisdictions are really having to shift right now in terms of the approach. Is there an underestimation of cases? Probably, but we know the lagging indicator is the hospitalization rate. So at the very least, as the numbers continue to grow, as we expect them to, we do expect to see hospitalizations go up. We do have a process whereby people are going to be POCT tested, and instead of getting the PCR if you're under the age of 50, then you're going to be directed to put that information in a portal in the GNB website. So we will still have the ability to capture that information, but it will rely on people, one, getting tested with POCT, as well as using that tool to be able to inform us.
Mr. Walworth, on va maintenant procéder avec Maria Isabelle Noël de Radio-Canada.
Yeah, Isabelle Noël, Radio-Canada.
Oui, bonjour. Cette question,
Yes, good day.
My question is for the Premier. Do you expect to extend the school year because learning online is not the same as being in class?
Will be kind of as we go through these next several weeks to determine to what extent we're seeing in the spread throughout our province, but to what extent our hospitalizations are being impacted. I think we all agree in-school learning is a preferred method, but we have to make sure that we're able to manage this spread in the next few weeks. So as the minister said, we would be monitoring every week, currently looking at the middle of January to return to classes, but that obviously could vary as a result of us being in a better position, but it's too early to tell. But hopefully, if we want to get a good year in this year so that we do have children learning back to full potential, and I guess it wouldn't be out of the realm of possibility to extend the season if.
Which will be heard at the same time.
Nicholas, can you hold off, please? We'll let Minister Cardy answer the question in French. Just hold off.
OK. OK, merci pour ça. Comme le ministre a souligné, on va prendre des décisions basées sur chaque semaine pour regarder l'impact sur le système scolaire. Comme le ministre Shephard a dit et le ministre Dr. Russell a souligné, on a maintenant une éclosion qui est en train de risquer la soutenabilité de notre système de santé. Alors, chaque semaine, on regardait les données pour assurer qu'on est encore dans une position que les écoles ont besoin de rester en conditions virtuelles ou on peut retourner à l'éducation face à face. Ça, c'est l'idéal, clairement. Mais si on a besoin de continuer de prendre les décisions difficiles, on va les faire, mais quelque chose qu'on peut voir avec les taux d'infectivité de Omicron, on peut voir que si on a les 1000 des cas, ça va assez rapidement passer partout dans la population. Alors ça, c'est quelque chose qu'on a besoin d'être soigné aux côtés du système de santé, mais pour le système d'éducation, ça donne un niveau d'optimisme que dans quelques semaines, on va avoir la chance de retourner à une condition plus normale. Mais on va prendre nos décisions basées sur l'évidence, comme toujours. Merci.
Mademoiselle Noël, as-tu une deuxième question?
What we can see with the positivity rate of infections for Omicron, if we have thousands of cases, it will certainly spread throughout the population very quickly. So for the education system, we're optimistic that in a few weeks we will have the chance to go back to more normal conditions, but we're going to make our decisions based on facts. Do you have another question? So what are the initiatives that are considered for children when we move to online learning? Thank you for the question. So for vulnerable children, we're going to do the same thing we did for other periods when we needed to move to online learning. And it's going to look like a more normal school day for those children. So we will need to make sure that they are welcomed in the virtual classroom like they are in in-person classrooms. So we're going to share the details with all affected families in the coming days to make sure that we can have a January that's as normal as possible for vulnerable students so that they can have a routine, so that they can have normal conditions every day and have a regular schedule. That's very important. So we're going to do what we can to preserve this as much as possible.
So other provinces have lowered the age of eligibility for PCSAT to 18 or over. And I was just wondering why New Brunswick hasn't done that yet.
So we will be maintaining 50 plus going into January, but very quickly in January, we will be lowering the age. And so the option that I guess the objective we're trying to reach is that the majority of our 50 plus people have either booked their appointments or received their booster, because they are the age group that that we have identified as probably being the most vulnerable. So as we've already done now, we've done our long-term care facilities, our First Nations communities. We've done vulnerable settings. We have included all of those age groups in those vaccination programs. And I would like to say that we do, as of this morning, there was a large number of unused booster appointments. So we want to encourage all those 50 plus to get their appointments in and get them booked so that we can move on to the younger age groups.
Ms. Seeley, do you have a quick second question?
Yes, I was just wondering if there are any situations where a person might have to wait for a specific type of vaccine, or if they could go with the first available vaccine appointment.
As of right now, based on what we know about the efficacy and safety of the vaccines, any of the mRNA vaccines can be used as a booster. The exception being people under the age of 30, I believe, because we're reserving those for Pfizer for those people, because it is recommended that they get Pfizer because of the risk of pericarditis and myocarditis.
CTV Laura Lyle, please.
Thanks, Bruce. With the changes in testing going into effect, I'm wondering if we're going to be getting an increased supply of rapid tests, given what will likely be an increase in demand, and how they're going to be distributed in the province.
So I can say that yes, we've leveled out our distribution this week, and we have to as of yesterday we had 1.19 million tests on hand. And they've been distributed throughout the province. But I will also just reiterate that 80% of that supply will be utilized in community programs, nursing homes, airports, and that's going to leave about 20% for the general public, which we feel is adequate for now. But on January the 6th, we'll be receiving another 504,000, which the province has purchased, and then between January 7th and the 12th, we'll be receiving another 2 million. Rapid tests for the public. So we feel that we have a good supply.
Ms. Lyle, do you have a quick second question?
I do. I'm wondering how many surgeries and procedures have had to be canceled or postponed because of the latest changes happening with the hospital system.
I don't have a full update on that. The team that is working diligently with our RHAs will probably be informing us of that by tomorrow, and we can hopefully get that information to you as soon as possible.
Thank you both. Alan Cochran, Brunswick News.
Thank you, Bruce. Question for Dr. Russell. As the Premier just noted a short time ago, the symptoms of the Omicron seem to be very similar to the cold or flu. Is there an easy way to tell the difference between a common cold and the Omicron, and when people really should do that test?
There isn't a lot of difference in the symptoms in terms of the early onset of sore throat and runny nose and congestion and things like that. And because there is the expectation that Omicron cases will go up so dramatically, it's better to be safe than sorry and assume you might have COVID and get tested regardless of what you may or may not think you have. So any symptoms would be, again, at this point in time, it's better to get tested. And again, as Minister Shephard mentioned, we will have more rapid test kits available soon.
Mr. Cochran, do you have a quick second question?
Yes, I do. So Dr. Russell explained briefly the new system for testing. It sounds a bit confusing. Will there be more information for the general public on this as we roll this out?
Yes, absolutely. We'll make sure that our website has that information, and I can repeat it again. It's people who are 50 plus will be required, if they test positive with a POCT, to get a PCR. People under the age of 50, a POCT is considered confirmatory if you're positive.
Thank you both. On va maintenant procéder avec Phil.
And now we will move to Félix Arsenault from Radio-Canada. Thank you, Bruce. My question is for Dr. Russell. So now people don't need to wait 5 days. Is that dangerous? Is this change a dangerous approach? Felix, can you please repeat your question? Yes, my question is regarding isolation. Isn't it dangerous? Did we put more people at risk? So, discussions were also done at the national level regarding if yes or no there will be people at risk. Yes, there are still risks, but how can we reduce the risk as much as possible, and how can we protect our healthcare system, protect our infrastructure, and other essential services in our province? So it's a balance. It's not perfect. Do you have a second question? Yes, quickly. We have seen in some regions before Christmas that people needed to go get some rapid tests. Will we be receiving more rapid tests? And put the emphasis on those rapid tests. Okay, well, regarding rapid tests, at this point, we have 1.19 million tests, and what we are planning for distribution with networks and RHAs and nursing homes, as well as airports, it means that we will reduce the number of doses by 80% by January 6th. After January 6th, between January 7th and January 12th, we will receive another 2 million rapid test kits from the federal government. And that's it. Thank you.
CBC Murnally.
This question is for Premier Blaine Higgs. Is there any indication that other staff members have tested positive?
No, not at this time. They have been testing as well, and no indication that they are. It's and I've been away from the staff directly for about a week now or so in that range. So we don't have any indication of others.
Thank you. Murnally, do you have a second question?
Yes, so with your positive COVID outcome, how does this change how government functions in any way?
Well, as you know, we're all well versed in working virtually these days, and that came as a result of COVID over the last couple of years. So for me, we've been continuing to hold meetings virtually, and we will continue to do that. And I have been doing that even with my colleagues across the country for the last several years. And so we've met, directly very few times, if at all. So it doesn't really change. Our meetings will continue. We'll hold cabinet meetings virtually as well, and with caucus and with other departments. So we'll continue on just as if we've learned to operate from our homes or from other areas, and I guess that's one of the benefits of having some experience with this, is we can keep businesses not as usual, but we can keep things moving.
Thank you both. Marlo Glass with Brunswick News.
Thanks, Bruce. My question is for Minister Shephard or Dr. Russell. Given that testing eligibility for PCR tests are changing on Tuesday, how will the backlog of PCR test requests in the St. John region be addressed?
So at this time, we are continuing with working with Horizon to increase the number of assessors at our assessment centers to clear that backlog. So the intent is that we would be doing so.
Ms. Class, do you have a second question?
Yes. Has the strategy for reducing the backlog of PCR test requests in Zone 2 been working, and what is the current number of backlog requests for PCR tests?
I don't have an updated figure today. Yesterday's figure was 2,200, and so we'll try to get you that information as soon as possible.
Thank you. We'll now proceed to CBC's Brooklyn Curry.
Hi, thank you, Bruce. The question for both Dr. Shephard and Dr. Russell, or Minister Shephard and Dr. Russell. I'm wondering about the new isolation requirements. If a person tests positive on a rapid test, the whole family is now isolating until day 5, if they're vaccinated, of the onset of their symptoms. How are they supposed to get additional testing kits?
Well, I think once that they understand that they have got a positive rapid test and they're isolating for 5 days, then they're pretty much through the protocol. If they require more tests, I would hope that they could call on a family member or a friend, a neighbor, to acquire more if it's necessary. But even at this point, with other family members, we would recommend that they probably test every couple of days as opposed to every day.
Ms. Curry, do you have a second question?
I do, yes. I know that Ed has been touched on briefly, but Dr. Strang had said in Nova Scotia yesterday that, he's working with Atlantic premiers to move away from daily case count toward more reporting on hospitalization. I know that this is something that you've indicated, is something that we need to be keeping an eye on. I'm just wondering, sort of moving forward, how you envision the daily reporting on COVID numbers changing in New Brunswick.
As of right now, the reporting will continue to be the same, but certainly the risks right now to the hospital system are not just around how many patients would need care for not just COVID-related illnesses, but non-COVID related acute illnesses. We do know that the impacts on the healthcare workers right now is significant, and we do expect that to continue. So all of the mitigation that we're doing right now is really around maximizing the resources that we do have, knowing that the cases are going to rise and knowing that hospitalizations are going to rise.
Thank you both. Before we close off, Minister Shephard's going to go to the podium and release today's numbers that just came in. Avant qu'on termine, Minister...
So before we finish today, Minister Shephard will give you today's numbers.
I can report that we have 190 recoveries, 682 new cases, 21 people in intensive care, and another 24 in hospital for a total of 45.
Thank you. Merci beaucoup. That concludes today's update. Thank you. Happy New Year to everyone. Voilà la fin de donc mise à jour. Merci beaucoup et bonne année.
Happy New Year, everyone. This concludes today's update.